bit about me. I was born and raised in Suwanee, Georgia. I went to the University of Georgia to complete my health promotion degree, and then went on to complete my nursing degree at the Medical College of Georgia, and subsequently my family nurse practitioner training at Georgia College and State University. I have a passion for health education, and sleep is such a critical role in a healthy lifestyle. And so today we're going to talk about the link between sleep and exercise. As a nurse practitioner who just recently came from family medicine, I am skilled in talking to patients about healthy diet and exercise. So I think many of us have heard this kind of spiel before, right? We know exercise is so important to reduce our risk of high blood pressure, diabetes, and heart disease. But what do we know about sleep and exercise? So we're going to talk today about how sleep improves when we exercise. So first off, how exactly does this work? Well, we know that exercise improves mood, right? So anxiety and depression are closely linked to disorders like insomnia. So getting in a good workout can help to boost the mood, reduce symptoms of anxiety and depression, resulting in adequate sleep. And this is because exercise reduces those natural mood lifters, the endorphins. So that can be so beneficial for mood and for sleep. So next we have the thermoregulation theory. So we know our body temperature goes up when we exercise. That subsequent fall in temperature helps to trigger our body's natural clock to help us to fall asleep quicker. Next, we know exposure to sunlight during physical activity is so beneficial because we get vitamin D from the sun. Vitamin D deficiency has been linked to sleep disorders, so getting out and getting sunshine helps us to get that vitamin D. And we know that exposure to natural sunlight helps us to make more melatonin, which is that sleep promoting hormone. So what type of exercise should I do to improve sleep? Well, it's really, some exercise is better than none. So I would find an activity that you enjoy doing, but specifically I want to talk about, 3 different styles of activity and how they benefit sleep. So the first is aerobic exercise, what we all think of, I think, when we hear the term exercise. So, running, jogging, if we have high intensity interval training classes, circuit training, kickboxing, Zumba, and you name it, those are going to be so beneficial because they get the heart rate up, right? So that moderate intensity exercise gets up that heart rate. We know aerobic exercise has been shown to increase sleep efficiency and increase sleep duration, even in children. So beneficial to get out there and get moving and get that moderate to vigorous intensity exercise in. We know strength training is also very important for bone health, right, for maintaining adequate weight. We also know from recent studies that resistance training has been found to increase sleep efficiency. And in this particular study that I'm thinking of and noting here, it decreases what we call wake after sleep onset. So those first few stages of sleep, that light sleep, making it easier to sleep through those stages instead of being disrupted. So strength training can make it so you fall asleep and then you're out until it's time to get up, until the alarm clock goes off, right? Next, we know yoga, meditation, and other mindfulness practices have been really shown to be very beneficial for sleep. Again, this goes back to they're helpful for mood, for anxiety and depression. We also know they release different neurotransmitters that are helpful when initiating sleep, such as GABA, right? So definitely get in some deep breathing, some restorative yoga postures. It can be super beneficial for sleep. So how much exercise should you get to improve sleep? Well, CDC recommends 150 minutes of moderate to vigorous activity per week. So you can break that up into 30 minutes 5 days a week. But some people just don't have the time, right? So some exercise is better than none. So consider breaking up your exercise into 10 or 15 minute chunks, a couple times a day, and finding something that works for you. So it's a marathon, not a sprint. We want to make it a lifestyle change instead of just a quick 7-day beach body exercise and then we kind of fall off. We want to have that lifestyle change so we can see that improvement in the sleep long term. What time of day is best to exercise? Well, I'm going to start off doing a little bit of Mythbusters here. So we've been told that vigorous exercise before bed has been found to be not good, right? So don't do high intensity interval training right before bed. So that for the most part is still true, right? We know that exercise increases that body temperature, and we have to wait for that body temperature to fall to help it to, get the benefits of improving sleep, making it easier to fall asleep. So 2 to 3 hours between a vigorous activity to bedtime is ideal, right? So if you have to exercise late in the day, make sure you have adequate time for that temperature to go down. And also exercise releases adrenaline. So making sure that, that adrenaline activates the brain. So making sure that you have plenty of time to get, rest and let the body temperature go down. And let the adrenaline and those other hormones that are released when we exercise get out of the system can be helpful as well to make it easier to fall asleep. So when is it best to exercise? Mid-morning to mid-afternoon is going to be ideal. You're going to get the most bang for your buck then. And the reason for that is that exercise can help to normalize circadian rhythms. So we found in studies that when we have research participants exercise at 7 a.m., 1 p.m., and 4 p.m., they are more likely to release melatonin earlier in the night. And so that makes it a lot easier to fall asleep. Again, we go back to it, easier time to fall asleep, easier staying asleep, and then also just increasing sleep efficiency. So exercise helps to normalize that circadian rhythm, and so timing it mid-morning to mid-afternoon can help with that. So getting that melatonin production right at that sweet spot. Finally, I have to mention again, just kind of circling back to the beginning, exercise is so important for mood, and we know that mood issues like anxiety and depression are so closely linked to insomnia. So we have seen several studies show exercise can improve subjective reports of patients who have chronic insomnia. So it's part of the treatment regimen for patients with chronic insomnia. We know it helps decrease symptoms as well of anxiety and depression, makes it easier to fall asleep, and then also in studies, patients who get that recommended 150 minutes per week have an easier time staying asleep as well. So they're not even having those sleep disturbances throughout the night. So of course, insomnia is a complex sleep disorder, and we would want to ensure that anyone having insomnia had an evaluation by a sleep specialist to ensure there was nothing else underlying going on that could be attributing to the insomnia. But overall, moral of the story, exercise is so important for sleep. Getting adequate exercise helps you to fall asleep quicker, stay asleep longer, and get that great slow wave sleep that helps you feel refreshed and restored in the morning. It helps to normalize sleep-wake cycles, and it can help with issues like insomnia. So get out there, get moving, find something you enjoy doing, and again, some exercise is better than none. So start small and work your way up. Thanks for joining me today as we had this brief little discussion about sleep and exercise, and get out there and get moving, and see you soon. Thanks.